So the task is Kate, 15 years old girl, presented with vomiting and diarrhea and dehydration, was admitted and treated and improved. Take focused history from Kate and give differential diagnosis and your management plan. Okay. So Dr. Supriya, you can keep the time, and Dr. Satish, you can start.
Okay. Good evening. I'm Dr. Satish, one of the doctors, and I believe you are Kate, right?
Yes, yeah, yes, doctor, I am Kate.
Okay. So how are you feeling, Kate, now?
Yes, doctor, I am fine now, but still I feel tired.
Okay. So I got to know that you presented with the to the hospital with the vomiting and the loose stool. Is that right?
Yes, doctor.
Okay. Can you tell me more about this vomiting and loose stools?
Yes, doctor. 3 days back, it started as loose stools and it was watery, and
Okay.
it increased in frequency. And
Okay.
along with that, started vomiting also. I
Okay.
started feeling too much thirsty. Then
Okay.
I was brought by my mother to the emergency. They told
Okay.
that I was dehydrated too much. I don't know. They did
Okay.
some blood tests and they told I am too much dehydrated, and they admitted me.
Okay. Okay. Do you remember how many times we have vomited on that day?
Yes, doctor, around 10 times.
Okay. Was it like throwing out or just it's spilling out from the mouth?
No, it was throwing out, but not
Okay.
very far, but it was throwing out.
Okay. Okay. So like, what about loose stools? How many times you had loose stools?
Loose stools also around 10 times, doctor. That's why I got too much dehydrated.
Okay. So like it was watery, it was mixed with some blood or mucus?
No, it was watery.
Okay. So beside this tummy, do you had tummy pain?
Yes, whenever before passing the stool, I used to have the tummy pain.
Okay. And do you had fever?
No, doctor.
Okay. So like on that day before starting vomiting and loose stool, do you remember anything that might have precipitated these things, like taking new foods or going out, some outside foods or anything like that?
Yes, doctor. Now I am 15 years old. I feel like going out with my friends and eating. The night before we had dinner outside with my friends, and
Okay.
but I don't think it's because of the food. My other friends don't have any symptoms.
Okay, that's okay. So before this, like, have you ever been having same symptoms in the past?
No, I don't have vomiting and diarrhea in the past, but I feel tired, doctor. I feel tired. I don't know why.
Okay, okay. So like, do you remember until when you were perfectly fine, but like you were not feeling tired?
No, I am tired. I feel tired daily now. It has become regular for me. Routine.
Since like how many months or how many days?
From 3 months, doctor. I don't know what's happening with me. I feel myself tired.
Okay, okay. So have you done anything for that? Have you visited any doctors or have you taken any medicines for
Uh,
that?
yes, doctor. Couple of times I went to GP. He told that
Okay,
he will do some tests for me, and
okay,
then he told he want to check the sugar. He checked the sugar. It was okay. Then
okay,
he told he will also check some blood test, which is seen for a period of time to see the blood control, sugar control in
okay,
the body. Even
okay,
that was fine. Then he
okay,
said, no, I don't think you are not eating or you are worried, you have some stress like this. He told me and he discharged me. Then this time what happened, this vomiting and diarrhea made me too much dehydrated. Then I was brought to emergency.
So you said like you had this low energy. Like, has this hampered you doing regular activities like going out with your friends, playing sports or anything like that?
Yes, doctor. Previously, I used to go with my friends almost 4 times a week. Now it's
Okay.
reduced to 1 time a week because I feel that if I go out with them, I get tired. I don't have energy to be active
Okay.
like them. So
Okay. Okay. What about your appetite? It's good or it has decreased or
I feel it's decreased.
okay. So do you feel dizzy when you stand up?
Yes, doctor. Once I had dizziness and I had fainting in school. There was a school in the school itself. They checked my blood pressure and they told that it was low. And then they gave me some salt foods and I relaxed for some time and I was fine.
Okay, okay. So, what about your weight? It's okay, or you have any concern regarding your weight?
I feel I have lost some, not too much weight loss, but I feel that I have lost some 3 kg, doctor, in these 3 months.
Okay, okay. Do you feel like you are okay with your weight, or you have also concern like you want to gain weight?
No, no, I don't want to gain weight actually, but I just told you that I have lost weight. I don't know why.
Okay. So, do you have any like problems with like your sweaty hands or not tolerating to the heats or like that?
No, doctor, I don't have sweaty hands and
Ah,
no heat. No, I
okay.
can tolerate heat.
So, what about you? Do you have any swelling in the neck?
No swellings in the neck.
Okay. So, do you have noticed any lumps or any swellings in any side of the bodies in your axilla or in the tummies?
No, doctor, no.
Okay. So, what about your menstruations? Is going okay, or it has it's do you have problem with it also?
Actually, I was getting regularly before, but from 3 months, I don't think it's regular. It comes, but maybe uh, every time 2 3 days delayed.
Mhm. Okay. Okay, so you feel like you lost weight, like, and do you have any are you avoiding foods, or you want to lose weight to have good figure?
No, no, no,
The in
no.
sort of thinking comes in your mind?
No, doctor. In fact, I love to go outside and eat dinner, variety of foods with my friend. No, these thoughts are not there for me.
Okay, so do you have any notice any rashes in the body, especially in these hands or in the your oral cavities in your mouth?
No, doctor. No, I cannot say as rash, but I had fair color before, but now
Okay.
I feel I am becoming darker. This is my thing. I feel that I am slowly becoming darker.
Okay. So for these reasons, have you been ever been tested for in the GPs or anything? Anyone told you any reports regarding your salts?
No, doctor. Actually, I told you initially in the starting of 3 months, initially only I visited GP once or twice maybe. First time he said it's nothing and he sent. At that time, I was not, I did not had these skin changes like darkness or something. But second time he checked for blood sugar. Then I did
Okay.
not visit him. Then suddenly I feel every day tired, but still I did not go. Then when this vomiting and loose motion happened, I am admitted, doctor.
Okay. So I will ask you a few questions. Like, do you have any other disease for which you have been taking long-term medicines or any reasons?
No, doctor, no disease and no.
Okay. Do you have any allergies with the drugs or foods?
5 minutes up.
No,
5 minutes
no
up.
allergies. Okay, thank you. 5 minutes.
Sorry, 9 minutes. 9 minutes.
Okay.
5 minutes.
Okay. Okay. Do you have any surgeries done for any reasons?
No, doctor, no surgeries.
Have you been ever admitted in hospital for these reasons or any other reasons other than this?
No, doctor. This is only from 3 months. I have problem. Before that, I had never. I had any problem.
Okay. Okay. So, Kate, like we might not know about your birth. Did your mom told anything that you feel significant regarding your birth time?
Yes, doctor. Once we went to GP and my mother was telling about my birth. He asked everything. I heard it. She
Okay,
said it was normal delivery and nothing significant.
okay.
Fine.
So have you taken all jabs?
Yes, up to date.
So, Kate, you are 15-year-olds, and what about your studies? It's going good, or you do have any issues regarding your
Yes,
studies?
doctor. I nowadays maybe from these 3 months, my school absence is progressively increasing. I'm not going
Okay.
to school regularly. Once or twice, I am in a week. I am not going, and my studies are going back. I am my grades are going down.
I'm really sorry to hear about it. But before that, your studies were good, right?
Yes, doctor.
And then you were participating in the sports also before.
Yes, I can't.
Okay. Okay. And then how frequently you are missing schools? Like once a week, or like
Twice
you
a
are not
week.
going at all?
Twice a week is maximum, doctor.
Okay. So how it gets better? Like you feel tired and you are not going to schools, and what do you do at home to make you better?
The doctor, I feel like eating something salty, like peanuts roasted salty or sauce like this. I eat something
Okay.
salty and I feel better.
Okay. So like how many siblings do you have?
I have two younger to me.
Okay. And how you are staying with your parents, or you are
Yes,
staying?
yes, doctor. I am staying with my parents, but my parents are separated. Maybe from
Okay.
1 year they are separated, and
Okay.
sometimes I stay with my father, sometimes I stay with my
Okay.
mother. And I feel this
Uh,
is also stressful for me because I have to take all my things from here, there, and school also. The distance differs like this. I am facing some problems, doctor.
okay. So who is taking care of your finances, your father or mother?
Yes, when I am with my father, everything will be by him. Both are sharing,
Mhm.
doctor. When I am with
Okay.
my mother will take care. Okay.
Okay. Then you don't have any problem regarding your financial, right?
No,
Or
doctor.
you do
No,
have
no,
issues?
no, no. It's okay. My mother is also working. My father is also working. No problem.
Okay, what about his siblings? Like, are they okay? Is there any family disease that is running in your family, in your father's side or mother's side?
Yes, doctor. One of my aunts on the father's side, she has a thyroid problem.
Okay, okay. So, Kate, I like to again. Do you didn't have any infections regarding like something like meningitis or anything in the past, right?
Well, I don't know what is meningitis, doctor.
Okay, okay. This looks little different. So if you, I'm just asking in a way like if you have heard or not. Okay, is there anything that I have missed to ask you? Then you feel like to share with me now?
Yes, doctor. As I told you, I don't know. I feel too much thirsty, and everyone tell maybe you have diabetes, but it's checked and it's normal. I don't
Uh,
know what's wrong with me. This is only is bothering me. I feel too much
uh,
thirsty, tired, and don't want to
uh,
go outside like this.
okay, okay, Kate. Thank you for such a nice history report on you.
Time up. Time up.
I'll be
Okay.
coming back to you. Okay, thank you.
Okay. Thank you. So, okay, give your I mean, the next step, what you do, present your case and give your differential diagnosis.
I took history from Kate. Kate is a 15-year-old girl who has presented with vomiting, loose stools, associated dehydration for last 3 days. On further questioning, I come to know that she has been suffering as a weakness, and she felt like no less energy for last 3 months, and 3 is also complaining for excessive thirsty, and she is excessive thirsty. Her menstruation um, has been disturbed, and she has been missing her schools because of the same problems. Um, and She also is stressed with her parents and getting separated, and she is staying on different house for the like she is also stressed with these family issues. With all the histories, and she has a uh, hyperpigmented rashes, and she feels that like she is getting darker, and she has some rashes on her body. She doesn't have any features of uh, like heat intolerance or sweaty hands. So she doesn't have any lumps, and she doesn't feel like she's getting um, uh, fatter, and her diabetes has been checked and it is normal. So blood sugar is normal. So with all these histories, my differential diagnosis would be Addison's disease, and the second would be will still come around like carcinomas or anorexia nervosa,
Okay.
hypothyroidism.
Okay. Okay. Tell me your investigations and management. How do you diagnose the Kate's condition now?
Um, After taking the proper history, I will assess the level of dehydrations, and I will check her blood electrolytes,
Okay.
and
So what do you see in the electrolytes if this is Addison's disease?
there will be hyponatremia, and I will do a ACTS stimulation test.
Okay, tell me about the potassium. What about the potassium?
Potassium will be high, right?
Okay. So electrolytes, then what else you will do?
I will do a baseline investigations like CBC and blood cultures, CBC CRPs with these to rule out any acute infections, because she presented with the loose stool and diarrhea. I'd also like to do urine examinations, and then urine electrolytes and stool examinations.
You want to
Then
do
I would like to do,
CBC, CRP, blood culture, urine, and stool. Okay.
yeah, yeah.
For the diagnosis of this condition, what do you want to do?
For the diagnosis of these conditions, I would like to do electrolytes followed by a ACTS stimulation test.
Okay. So what will be your
And
result?
ACTS stimulation test will be uh, uh, synthetic injection. This ACTS will be injected, and to see the level of this cortisol, if it is rising or not.
So what happens in these patients?
It's not rising.
Okay. Okay. So it is not rising. So what will be your management now? If you want to control her, improve her tiredness, how will you manage her now?
I need to replace the adrenocortical hormones. That is like hydrocortisones, and is the drug of choice.
Okay, only hydrocortisone. Anything else you will add?
Glucocorticoid and mineralocorticoids also I need to be supplemented.
Okay, so you want to tell about the team you want to involve in this patient?
Okay. So I would like to involve my consultant, and then diabetic this hormone doctor, endocrinologist, since it's a hormonal problems, and then I will also involve the because she has problem with her studies, and
Okay.
parents but
Yes.
separated. And then I would like to involve her school teachers and social service, and it will be a multidisciplinary team.
Yeah, psychologist, because she has
Psychologist, yeah.
and other problems, psychologist and all those things. Okay, so suppose if she presented to you in the adrenal crisis, then how do you manage her? If
Adrenal crisis, this will be on the shock. So I will be managing the shock with the volume replacement, and then by correcting the hypotensions, and then with the IV hydrocortisone. And I will also check for the blood glucose level. They are generally present with the hypoglycemia. I mean, I need to give the glucose supplementation if there is a hypoglycemia.
okay. So one shot of hydrocortisone is enough, or you want to continue with any?
No, I want to continue with this. Like after she is stable, I will continue with this intramuscular, the oral one.
Okay, what about the education? How do you educate her about the importance of her
Okay,
disease?
so this I will educate both the parents and the child and herself regarding the disease process and regarding this deficiency of these hormones that regulate the salt in her body, and that is very important to maintain the blood pressures and other things. She needs to take these medicines for lifelong, and this is only the solutions that is currently available to make her fit. And if he's taking medicine regularly, and if she's complaints, she can live a almost normal life.
Okay, how do you explain her that if she has crisis and all, how she will know and how she will manage herself?
Okay, she will be excessive thirsty. There will be some dehydrations, and she will be feeling like fainting, dizzy, and if so, she has to take salt and water or ORS, oral rehydration saline package, orally, and she has to report to the hospital.
She should have something with her always.
Yeah, intramuscular hydrocortisone. I'm not sure for these things.
What about some bracelet and?
Okay. She has to wear this bracelet. So she has to inform her friends,
the people around her should know about her.
Yeah, should know that people around her should know that she has.
Yeah, in the school, maybe the school nurse, school teacher should know, and even her close friends should know, so that if anything happens with her, to be reported. Okay.
Yeah.
I think we are done, but we need to discuss more about the adrenal crisis.
Yeah. I haven't checked this for a long time, so let's
Time
revise.
is there or finish, Dr. Supriya?
Yes.
9 minutes.
Almost finished.
Okay.
Yeah.
1 minute.
Now time is finished.
Okay. Thank you. It's Shadi Muhammad. Your mic is open. Okay, I will give feedback to Dr. Satish. And also, after I give feedback, all of you, please, if I miss anything, also you can add it. And also, if he has missed something, please add it, because we have to refresh ourselves always. Yes, Dr. Satish, regarding your history of presenting illness, yes, you explored about vomiting, diarrhea, and also about how was it mucus, blood, and fever was associated or not. You explored it, and you asked also what done so far. So I told 2 times visited for the GP. Okay, and he did tests for this diabetes. And medications, allergies were asked, weight was asked, but also you could have asked about nutrition. You did not ask about particular foods, but you asked. I told that dinner will be outside, and also you ruled out, you keep anorexia nervosa in your mind, and you ruled out by asking some questions about it, like does she wants to be thinner, does she likes that. It was good. And for hyperthyroidism, you ruled out by asking sweating and intolerance, and also swelling in the neck, lumps. And when you asked about the skin, you got an important clue that she's becoming darker slowly. Then there was nothing about puberty also you explored. It is good, positive point. You could have asked about some behavioral issues which you did not ask. Behavioral issues you did not ask. Okay. Then joints also were missed, but since as a routine systemic review, you could have asked anything in the joints, it was missed. And behavior was missed. And any CNS symptoms were also not asked, like a headache and any in CNS also the behavior comes, and also the abnormal movements as routine. Maybe sometimes if it is due to the central causes also, so you have to rule out. You did not ask about CNS. In the pregnancy, it was nothing significant. Development, you did not ask only, just you would have asked one word. Are you same like your friends growing, or anything you want to tell like this, you did not ask. Vaccination was asked, past history was asked. You use the problem with you is sometimes you use meningitis, hyperthyroidism like this. The role player will not tell this. That's why I told you to remind you that what is meningitis, doctor, like this. Okay, don't use these words. You can ask if you really want to ask about meningitis, ask anytime any brain infection like this, not meningitis. So this was the mistake. Regarding the family history, you just asked about the siblings and any thyroid problems in the family. That's it. You did not ask about consanguinity or anything. And in the social history, school was explored very nicely, and also about the parents it was explored. And but you did not ask about the heads much. You could have asked because she's you could have asked any habits of smoking, alcohol, if she has, or if she's feeling hopeless, or anytime if she has any thoughts of like this, like one or two questions you would have added here. That's all. Otherwise, I think overall it's okay. Just you missed was this some behavioral, about her behavior and mood changes you did not ask, and some histories from the heads was missed. Otherwise, you explored about the hyperpigmentation, which is important, and also the salt, love for the salty diet when she feels tired. But when you are presenting, you did not mention about this salty diet. Okay, I wrote here, when you are presenting, you did not mention, because here the important thing to mention was she's feeling herself as darker. This is one of the thing, in the salty diet. Okay, this you did not present. Otherwise, you put everything in your this Addison's, anorexia, hyperthyroidism. I think it was fine regarding the diagnosis and management. But for the Addison's crisis, we should know good, so we can go through the management of it later. Maybe it can, if it comes as the video case, or they may ask you the questions about the management of crisis. Okay, so when you tell the management of crisis, you should always start with ABC. Okay, you did not tell about it, you directly went for the perfusion, giving IV fluids. It is good. And also about the glucose you said, which is very good, monitoring the glucose and giving. But before that, you should still, you will start with the ABCs, monitor blood pressure. Okay, and also Glasgow coma scale. Sometimes they can present on with loss of consciousness, tired like this. So BP, Glasgow coma scale, and you will take bloods for investigations, and you'll start the bolus IV fluid. At the same time, you will check blood glucose. If blood glucose is low, you will also give the D10 for her. Okay. So otherwise, I think it was fine. So anything I missed or Dr. Satish missed? We have 66 participants here. Can give your feedback. Yes. No comments.
I think, excuse me,
Yes.
I think in the history he should ask about the other autoimmune disease, not only hypothyroidism. He should ask about vitiligo. He should ask about short, the length or the height, short stature or not.
Okay. Okay, I agree with you. He maybe here it was vomiting and diarrhea, and she was losing weight. Maybe that's why he asked only about hyperthyroidism and he left. But still, he would have asked about the stature as well. I agree with you. When we ruled out hyper, at the same time, we should rule out any associated hypothyroidism as well. Feeling intolerance to cold and other things can be asked. Yes, for the diabetes, it was told by the role player itself that she does not have diabetes, and he excluded anorexia. What else you want to exclude about the celiac disease or anything? Yes, I can't hear anyone. Anyone is speaking? Okay, I will be sharing for the management of Addison's crisis. But before that, please, whoever is writing in the chat, if you open up and speak, it will be better rather than writing here. Sometimes I don't see the chats at all. Yes, Dr. Tamanna, you want to tell anything?
Dr. Noor, there is a meeting of Dr.
There is meeting of whom? I can't hear you. Open.
There is a meeting of Dr. Wajud.
Okay, but we did not receive any links. Did you send?
Yeah,
the
it's in my group. Yeah, it's in my group. See, I just saw. I also did not know.
So
I think I think you can finish. I think you can finish, and then we can join there. You finished it.
okay, is it unlimited? Because maybe we join and it's more than 100 or something like this.
Yeah, it is. Maybe it is not unlimited. So better we join now.
One of us can just check, because we will stop this and then go back and come. It will be difficult.
No, till it is 33. Till it is 33, okay? 33 participants. So you and me, another here 60 participants.
Dr. Tamanna, please share the link on your group as well.
Yeah,
It
yeah,
is not there.
Yeah.
Okay, whoever is interested presently can join, but I will finish this case. I want to finish this case.
Dr. Noor, we can finish in 5 to 10 minutes.
Yeah.
Maybe I have duty actually. So
Yeah, please
okay,
finish it.
I just want to go through this only and we will finish.
okay.
So we will just read about the acute illness, okay? During illness, corticosteroid dependent children can usually be managed at home. If able to take hydrocortisone orally, give stress dose of hydrocortisone 30 mg per meter square per day as 4 divided doses 6 hourly for 2 to 3 days. Okay. When you think that they are ill but they can be manageable at home, they can be managed by giving hydrocortisone orally. Okay. He is given the stress dose here as 4 divided doses. If unable to take oral corticosteroids, that is vomiting or acute collapse, parents to administer the hydrocortisone IM. So they should also always have hydrocortisone IM with them. Okay. So these are the doses. For our case, it will be definitely 100 mg. So if not able to take orally and vomiting or collapse, they can immediately administer this at home. If hydrocortisone IM required, hospital assessment is necessary. If hydrocortisone IM not available, child too unwell to take oral corticosteroids, call 999. Continue usual dose of other medications, example fluorocortisone, levothyroxine, desmopressin, growth hormone, etc. But we don't know if they are acutely ill, if they are not taking. We don't know if they are able to take other drugs also. Try to immediately go to the emergency. Then management of unwell corticosteroid dependent children requiring a hospital assessment. So always start with, when you are asked this question, always start with ABC. Somebody's this is video is open. Okay. So what we will do, when in times of crisis, you will first resuscitate the child, that is look for the ABC, monitor blood pressure and Glasgow Coma Scale. You will obtain an IV access and take blood for full blood count, glucose, blood culture, urea and electrolytes, bicarbonate, and blood gas is very important. I don't know if Dr. Satish said blood gas or not.
No, I missed blood gas.
Yeah, because the degree of dehydration and also lactate. Okay, for 2 reasons. So glucose, he told, yes, he told FBC, blood culture to rule out infections. He told all these things, but he forgot bicarbonate and blood gas. Okay. If blood glucose less than 4 millimoles per liter, you have to give bolus of D10, 2 ml per kg. Okay. So check the blood glucose. If it is less than 4 millimoles, you will give D10, 2 ml per kg. First line treatment, give hydrocortisone IV as single stat dose, followed by either continuous infusion or 6 hourly divided doses to avoid peaks and troughs. Okay. So at least just remember that you will give the single stat dose. I think that is 100 mg IV for this patient. And then you will followed by either continuous infusion or 6 hourly divided doses. Okay. Then you have to maintain blood sugar more than 4 millimoles. If shock, give sodium chloride 0.9%, 20 ml per kg. Commence IV maintenance with sodium chloride 0.9% and glucose 5% at maintenance rate. Okay. So after giving 20 ml per kg, you have to assess. If they need more, you can give. Otherwise, you have to give the maintenance dose with D5NS, glucose 5% and sodium chloride 9.9%, and extra if dehydrated. Add potassium depending upon the electrolyte result. Okay. Severely ill, commence hydrocortisone infusion. When oral fluids tolerated, change to hydrocortisone 30 mg per meter square per day orally 6 hourly in 4 divided doses, and continue for 3 to 4 days after recovery from acute episode. Okay. Discuss any concerns with on-call consultant endocrinologist. Okay. This is the thing you will tell when you are asked about the management of crisis in these patients. Okay. Anyone wants to add anything? Okay, is the Tamanna, did you share the link?
Yes, it is started.
Where is the link? I don't know.
In my group, yeah. Someone shared actually. I did not share.
No, it is
Someone
not
shared.
there in your group. Can you share with me so that I will share in my groups and I will join and see
Yeah, I'm sharing.
if
I'm
it
sharing
is
in every group.
allowing us and if
Has
we
it, Dr.
can.
Noor?
What?
Wait. I'm sharing
Thank you,
in
Noor.
everybody. Every group. Wait.
Thank you for your.
I can't hear anyone here. Wait, I will mute all. Okay, yeah, yes, Dr. Satish. Open your mic.
Dr. Noor, it is more than 100 participants, till now 106. And I think in your group, the messages come.
Okay. If no, we can, it means it is unlimited or what?
So more than 100 to mostly unlimited, now. Otherwise, 100 is the cutoff as far as I don't know, but I think so.
Okay, if it is informative and if all of us wants to join, we can join, no problem for me. Let's join and see, okay? But I did not receive any link in any of my.
Actually, Telegram had shown the link yesterday, but I did not know who is this. So I was also not sure. Now, Dr. Tamanna, when she said, then I realized.
In Telegram also, I don't know where. Can someone post in my group, please?
It is there, Dr. Noor, in your group already.
Okay, I will check.
Dr. Hazim number, unlimited, yeah.
Okay.
That's one good side, and that's, I think, that gives you hope and some energy to get on with it and do it. So clinical exams, I did my clinical exam in February 2019. So I did it the old-fashioned way, and then it changed. It changed very slightly, and then again it changed because of COVID. Okay. And I'm sure many of you are trying to get some seats and trying to book for the exam, and because of what happened there have been some difficulties. At the moment, the exam in the UK is virtual, and I think it's going to be virtual for quite some time. Okay, I wouldn't expect it in 2022 to change, possibly not in 2023. It wouldn't change. Actually, it would not change. This is my expectation. I'm not saying this is going to happen, but because the